Hi everyone. Today we have a doctor. She's a wellness specialist, and we are waiting for her to join so that we can start our chit chat. I assure you that this is going to be like so much informative. Let's wait for a few more minutes. She'll be here.
One second. Hi.
Hi, Dr. Pandya.
Hello. How are you?
I'm doing well. How are you?
I'm doing great. Can you hear me?
Welcome to Girls Bus. Yeah, totally. Yes.
Yeah.
Let's start.
Yeah.
Yeah. So, hi everyone. I'm Samyati from Girls Bus, and today we have a lovely doctor. She's a wellness doctor, and today we have her to talk about female sexual health and PCOS. So, this is going to be full of information. If you even miss out, just go and check out Girls Buzz, and you'll find it like this will be the app thing. Welcome, Dr. Krina Pandya. Um, if I missed out anything about yourself, please go ahead and introduce yourself.
Okay. I'm practicing homeopathy since 10 years in Ahmedabad, Gujarat. And I also practice nutrition. I see basically weight loss patients and also do counseling for mental health patients. So it is like homeopathy plus nutrition and plus that is counseling.
Yeah, that is really great. And usually homeopathy is a very different stream. So this is great to know about you, doctor. Um, Doctor,
Thank you so
today
much.
we are going to today we are going to speak about something that is not spoken about much, and we would like to know about it from you. That why is this considered as a taboo, and why are people basically embarrassed to talk about it? As per your experience, what might be the reason?
That is basically, the word sex itself is we are like hush hush. We should not speak that word. Since childhood only, it is, your private parts. It's your private part, and you can't even discuss anything with your parents also about it. So it is always a secret topic, or there is a you are always taught that it is a dirty thing. It is immoralistic. It is a
Yeah.
taboo. So
Yes.
that is the base. The society has framed it in that way, and we need more of awareness for it. That is the main reason, because this is the reason. That is why the females are more suffering on this, because it
Yes.
is something which you feel embarrassed to talk about with anyone. So it is the societal frame which has
Yeah.
made this sex taboo, which is actually not at all needed. Especially it is in Indian society, while outside it is not that. You can find it here more. That is the thing.
Yes, totally right. Doctor, while there is a taboo on discussing about sexual health, how common it is about about not talking?
So, sexual health problems, is really common, especially in female, because the you can medical conditions is a different thing, but
Yeah.
the main problem is the low libido due to societal pressure, due to
Yes.
preconceived notions like this you cannot do, you cannot show the pleasure, you cannot show that you also like it, all that stuff
Right.
has already built up a pressure on the young girls who are getting married or are in relationship. So that is the reason why the reason it is causing the low desire, because of the
Yes.
pressure which is causing the stress, right? So that is the thing. Second thing is that there are other medical conditions which can cause the this sexual health problems, like uh, vaginismus, that is dyspareunia, and other conditions. And so whenever the intercourse happens, there is pain, and due to this, there is
Yeah.
the female feels that I should not go for it because the pain is that
Right.
there. That is the reason. So all these conditions are very common, which I feel uh, every 60 to 70% female goes through this. It happens, especially the low arousal level, vaginal dryness, all of this. It happens.
Yeah. 60 to 70%. It's a huge amount. Um,
Yeah, it is.
Moving on.
It
Yeah.
doesn't, all of this doesn't come out because this is the topic which no one discusses. Even
Right.
with their,
Absolutely.
I swear, with their
Even
friends also, they might be
yeah.
discussing what.
Absolutely right. Like even from the teenagers, when the people start experiencing such things, and that is the right time to talk about, we often neglect that. So this is the reason why
Exactly.
why we don't discuss it. So moving on to the like next question, what would be your advice to people who need to seek help on sexual issues?
Sorry.
What would you like to suggest or advise to the people who actually need to seek help on sexual health issues?
So, I would suggest that for a female should be very aware about her sexual health because it is her right, first of all, and she should first of all not at all be concerned about the taboo thing, or that it is you should not discuss about it, is a hush hush thing. No, it is nothing like
Yeah,
that. You have equal rights, you have equal, you can show your pleasure, you can show how much you like it, you can show your desires with your spouse or your whoever in a relationship. You can discuss with your friends about it, whatever your problem is, because
right.
the more you are going to suppress your sexual problems, your sexual health problems, like even a small boil over that part, you don't discuss, you don't tell your parent also that I got
Yes,
a boil there, or yeah, you shave your hair over there, and at that time you don't even tell, मतलब, like that घर पे ऐसा
yes,
हो जाता
right.
है कि यार ये hair shave करना is also, it is a like taboo कि क्यों किया है and all that. So it is an Indian society, all that thing. So that we need
Yes,
to change it. So
right.
because then if you are going to
Yeah,
speak more about it, discuss more about it, you will be open and you will face less sexual health problems.
right.
That is the thing.
Yeah.
So be
So,
open and
doctor, can
talk.
you tell us?
That is
Doctor, can you tell us what type of sexual issues affect women in general, like with a brief description about them?
Okay, so women goes through a lot of sexual health problems, which first, as I told you, low libido. The sexual desire is very less due to many reasons: societal pressure, low estrogen, hormonal changes. Uh, Post pregnancy also low libido is very common. You know that which can cause a lot of relationship problems, mood swings, and everything. After marriage, post marriage also due to home atmosphere, she is not able to accept the change. This thing can happen. So low libido is the main thing. Then there is dyspareunia, that is while doing intercourse there is pain in vagina. So that can also affect the mental health of a female, and she wants to stop it over there only. Then there is again sexually, is she is not aroused much. Orgasm, she is not able to reach the orgasm properly. She is not, her emotional level is not able to satisfied. So that time also this
Yes.
thing can happen. And other apart from that, the other sexual health problems which she faces is infertility also due to the stress she
Yeah.
goes through all of this. So all
Right.
these things can happen.
Yeah. So, doctor, what causes sexual problems and how to identify sexual health problems? Like, what are the tests that are needed?
Yeah, so see, STD is a different thing. Like sexually transmitted disease is a different thing. So that is when you have more than one partner, you can get infected with it. Or if you're not using proper contraceptive method, that is, or barrier method, that is condom or dental dam or anything. So that can cause this STD. So
Yes.
most of the time, so for that, you blood samples, urine samples, and pH level you have to measure, and means you have to meet a gynecologist for that. So
Okay.
that is the thing where it happens. But for sexual health problems, like as I told you, low libido is there. You cannot do proper sexual function. The intercourse is not satisfactory at any level, emotional level or even your physical level. It is not satisfactory to the
Yeah.
female. That time you can meet a homeopath also. You can meet a gynecologist, a sexual health expert also.
Right. Yes.
That is,
Okay. So,
there are
what
many
are the
there are many other reasons also, like in menopause, then
definitely? Yeah.
past trauma is there. All of this,
Yeah.
all of that affects the sexual health of the female. There's a lot of things.
Right. Yeah. There are so many that even people who are hearing, women who are hearing you right now, they I like most of the people, they don't know about the terms and they are unaware about their health conditions, especially about sexual health. So
Yeah.
thank you so much, doctor, for informing these things. Moving on to the next question. Um, can you share with us a real life experience where a patient didn't realize she had a sexual health issue until she visited you?
So yeah, so she was. I had a patient. There are many patients who are in depression and go through, who are, go through this phase where they have very low libido. They have dyspareunia, and there is also I had one or two patients of vaginismus also, where their contraction happens as soon as something the spinous touches the vagina. The pain. So she is not able to perform the intercourse. But this patient, I remember, she had come to me for depression, and she was like, everything she told me, as we in homeopathy we take everything in detail, like history, we have all detailed history. So then we came to know that she has, like I came to know that she has that after post pregnancy she has gone completely asexual. Like
Oh,
I don't. She doesn't feel anything for both genders or nothing. Nothing. No desire for sex. Nothing.
okay.
So that was due to trauma post pregnancy and hormonal changes. So due to that, she was, she didn't know that. She just felt now it's okay. I don't feel, and her husband was also okay with that
Yeah,
because she didn't like only. She was, in fact, she was more of that got indifferent to that. That
okay.
this should not happen. It's like that. Sex should not happen. It's like that. So I counseled her and I gave homeopathic medicines for her depression and for the same thing. And for I think so 3 to 6 months she came out of it. She and her husband were completely okay. They started having their intercourse and everything. So they were good.
Yeah,
So she started liking this thing. So this is a very good example where which I actually really liked. This she was completely she was out of this. It was the
right.
trauma post
Yeah,
pregnancy and also hormone changes really affect
yes,
post pregnancy. Many female it affects like anything. And
yeah.
so this was really a good experience.
Okay. So, just like this, the problem that you stated just now, what are the signs women often miss out to, like identify their sexual health issues?
So yeah, so when there is if the first signs which we see, it can be rashes, this bumps or inside the vaginal part, that pain while intercourse, that unusual bleeding anytime, then there can be severe burning while urination, even severe burning while doing while intercourse. So that things are very important to notice, and you have to have to speak at that moment only, or tell the meet a doctor, any doctor
Yeah,
you can meet, and they can guide you. Okay, it's like that.
yes.
So that is the thing.
Okay. So, doctor, we are also discussing about PCOS, and in female sexual health, that is a like upcoming issue or a topic that women like to have tons of information because they are facing it to a maximum level. So, like you have experienced so much. So, are there any sexual dysfunctions related to PCOS that your patients have complained? If there are, what are those?
Yeah. So PCO is basically endocrine disorder, and it is multi-system problem. So
Yeah,
what happens is that there are a lot of system involved, not just hormones. Even the psychological impact is also a lot on a PCOS female. So that
yeah,
psychological impact causes massive trauma while performing sex. You know, a body image because of hirsutism, hair
yeah,
overgrowth of hair, acne, obesity.
yeah,
Then in many female patient, even there is hyperclitoris, like clitorimegaly is seen. Then there is, other scars, like acne scars are left. So all these things causes a lot of body image issues in PCOS women. So that causes again mood swings are there, and all of
yes,
this causes low sex drive. Arousal rate is really less, and 60%, 57 to 60% female PCOS female has this low arousal rate and
yeah,
less interest in sex. So that is the reason why PCOS, because of the hormones and hyper androgens. So that is the reason why it can cause this low sexual desire. Again, obesity
yeah,
is there, so it interferes with the sexual, the active sexual, there is limitation comes. So all of this happens. So the partner how you get is also I feel is plays a major role in this,
True.
especially for
Yeah.
PCOS female because
So, another question, just with a follow-up with the previous one, can PCOS lead to any sexual health issues or vice versa?
sorry
Uh,
PCOS
can you hear me?
question I missed out the question.
Yeah. Yeah. Can PCOS lead to any sexual health issues or vice versa?
Uh, No, exactly. As I told you, this only infertility can happen because low sexual desire, even society norms
Yes.
that you want. Infertility is there, so uh, PCOS patient, polycystic ovaries are there. There is irregular periods and everything. So
Yeah.
there are. It's not that they cannot get pregnant or something, but it's high chances that they take time. So due to
Yeah.
time, what happens that the society's pressure is a lot of pressure.
Yes.
So that can cause mental stress on the patient and I mean female. So that can
Yeah.
give rise to this sexual health problems. Again, you can see there is pain while because of dryness is there. There is low libido. You don't feel like
Right.
you cannot open up properly. There are mood swings. All
Yeah.
of this is there. So uh, there is definitely painful intercourse is there.
Yes.
So this is the basic reason.
Yeah. Doctor, are there any specific guidelines for women with PCOS with regards to sexual health issues?
PCOS women should guidelines like they should basically what I feel is they should open up and talk with their spouse, parents, and a doctor. They should be more aware about her own problems that because of
Yeah.
PCOS I have this and it's okay. There should be awareness about it. She should be self-aware and even with her spouse or whoever she is in relationship should be aware about it, then there can be less consequences and she can definitely get aroused also if the proper partner is proper, so that is the thing.
Yeah. So
You
there,
can make her feel that
yeah,
she should not feel that the body shaming should be not felt. She has
yes,
PCOS and she should not feel about it. That's
yeah. So, especially the other members should try to make it up to her, like make her feel less inferior and totally okay if she wants something and
yeah.
she feels in a certain way. Yeah. How
Exactly.
can
Actually, what I
women,
feel is
yeah,
every female in Indian society, we are more tend into that how we should please a man.
yeah,
What about female pleasure? It is like it is
right,
considered a taboo that female should not express. Female should not feel
yeah,
good. If she expresses a lot or she finds a pleasure, if she even tells by herself that okay, I want to have this, I want to have sex or anything, it is a taboo. Oh my God, like that.
yeah,
It's like that. So how your partner is, that is important. This is what I feel.
right,
So
yes.
that is the thing, or how your understanding is with your partner. So that thing can make you more easier. And for
So,
PCS female, it gets more
we should,
struggleful.
yes, yeah. Doctor, are there any medications in homeopathy for sexual health issues?
Yeah, homeopathic medicines, as I told you, has amazing results for vaginitis, then like vagina infection in vagina, then if there is inflammation, there is this painful intercourse, bleeding while intercourse, then burning while intercourse is there, vaginal dryness is there.
Yeah,
Then, if there is stress, there is a psychosomatic reason for it. For everything, we have medicines for it, and we treat it. I have lot of patients with, we don't explain all of this thing, but
yes,
I personally treat with, give them counsel them, advise them like this, you have to do it. You don't have to feel
Yeah.
shameful about it. And you have to just uh, take the medicines and you'll be fine. So for all of this medicine is there. For PCOS patient also, we advise homeopathic because it was
Yeah.
gives really good result. It is does not mean that we are going to reverse PCOS, but
Yeah.
the symptoms are
We
get
can
better.
regulate and
The
control.
hormones,
Yes.
we can balance the hormones. Everything it
Yeah.
definitely helps. I'm going to I'll share you one case of mine. She was just
Sure.
engaged
Yeah.
when she came to me. That yeah, so she came like, ma'am, we were having this. First of all, she was so shy that she was speaking like, ma'am, we had. I said, what you had? Like, ma'am, we had. Okay, please be clear. So I explained. So that is the first thing. Like I explained her that you have to say clearly. बोलो कुछ problem नहीं है. आपको जो मन में आ रहा है
Yeah.
जैसे आ रहा है बोलो. So the problem starts with words. हमको पता ही नहीं है
Right.
कि कैसे explain करें क्योंकि वो words ही हमें आते
Right.
नहीं है. हिंदी
हाँ.
में बोल
Right.
रहे हैं पर हिंदी में भी आते नहीं है. इंग्लिश में भी we know intercourse is again a term which not everyone knows.
Yeah.
सब पीपल को सेक्स बोलना नहीं है किसी को ऐसा है तो वो दूसरे वर्ड्स
हाँ.
ढूंढते हैं जो है नहीं तो दिस ऑल्सो हैपेंस मिसकम्युनिकेशन हो जाता है
Yes. हाँ.
सो शी केम टू मी एंड हमने किया एंड मुझे इतना पेनफुल लगा कि मैंने उसको लात मार दी इट वॉज फर्स्ट टाइम इट वॉज थर्ड टू फोर्थ टाइम वी डिड एंड मैंने उसको लात मार दी एंड मुझसे रहा ही नहीं गया फिर अगेन आई टुक फिर मैंने किया क्योंकि मैर तो करना ही पड़ेगा ये तो हमारा कर्म है ये तो हमारी ड्यूटी है अगर हम नहीं करेंगे मैर तो फिर कौन करेगा सी दिस इज द वर्ड्स and this is majority of words they think that if we will not do it it is our duty so when you think that it is our
Yeah.
duty it's a burden for you you are not enjoying it you are just
Right.
uh, passing it like अभी करना है मतलब it is a work for you तो घर का what happens is typical Indian female after marriage घर का काम करो जॉइंट फैमिली है तो सब कुछ मतलब योर रिस्पॉन्सिबिलिटी बेटा है बच्चा है तो
Yeah.
अगेन दैट रिस्पॉन्सिबिलिटी एंड अगेन
Right.
रात को इट इज अ वर्क फॉर यू सो एंड most of them it happens that husband nahi samajhte and all that stuff so for her also it's the same thing happened she had severe pain burning she was having vaginal infection actually but she didn't knew
Oh.
this
Okay.
उसको पता नहीं था उसको लगा ये दो बार किया तब तो कुछ नहीं अब भी क्यों हो रहा है I gave her medicine. She was better. Then again, she came. Then she was better, and she told that now I am better. So this is the thing. So there again, fight also happens for such things. That मैंने उसको लात मारी that our husband how he will react. And we really need a lot of awareness for this because these are simple घरेलू problem kind of which don't come out.
Yes.
Because I have patients, so I
So
actually thought that
actually,
this should
it's not
be,
herself. Yeah.
yeah.
Can you hear me?
What did you say? I didn't hear you.
Yeah, I was just saying that it's not actually herself. It's the society, the people she is living with, and it is the mentality that grows that it is always a woman's work to please everyone. She cannot say no to anyone. Yeah, that is the thing you're talking
Exactly.
about. Like it is, I completely agree. It happens.
Yeah.
Yeah.
So this is
So
the
yeah,
basic. Yeah. So
yes,
that is what we need to seriously spread awareness. Means this is a simple problem, but it is really tough for a Indian female to go through this. Uh,
right.
if they have medical conditions, then it is a different thing, totally. But even in
Yeah,
regular thing, if they are not properly aroused, if the thing is they are having low sexual desire, or I think
yeah.
if it is not met through, then they have a problem. So, so I thought that sex education is really important. Sex
Totally.
awareness,
Yes.
sex education is most important.
We are definitely missing on that. So this
Yeah,
is the only
exactly.
option that is left out. We need personal counseling. Even there, we hesitate to talk about
Yeah,
our own problems. Yeah.
yeah.
ये सोच के कि लोग
So
क्या
people
सोचेंगे.
don't go for
Yeah.
counseling that often for such things. So that is what
Yes.
happens. And we are actually homeopathy really helps in this thing, because when patient comes to it, we can go through it and get proper detailed out of it, and we counsel also your medicine.
Yeah.
So we come to know a lot of patients through this.
Yes.
They don't come directly, but from one disease we can go through this and we can treat that. So we get experience in
Yeah.
that way.
Right. Yes. So before we move on to our further discussions, I would like to ask people who are watching us, you can put your questions in the comment section, or there is a question bar there. We would love to
Yeah, if
discuss
anyone has any
those
question.
topics too. Yeah. So, doctor, how can women especially take care of themselves if they're facing sexual health problems? Any tips you would like to share with them?
Uh, See, first, you have to. I would seriously tell that take care of what you are eating, what you are wearing. Your undergarments also matter, because it can also, if you don't care of it, you can get chances of, you can get infections through it. Hygiene should be maintained. Then So intimate part hygiene, again, washing it properly, removing your hair and everything, that is all important thing.
Yeah.
So that does matter. Drink proper water, fluid intake should be good, so that you can avoid vaginal infections.
Yes.
Use condoms while you are having the pose. Even if only one partner is there, then also use condoms, because there are different type of viruses which can sexually transmitted viruses which can cause infection. So it's better to
Yeah.
be uh, you know vigilant than get a disease or something like that.
Right.
And speak.
Yes. True.
Most important,
Um,
speak out your feelings,
yeah.
speak out your emotions, whatever you
Yes.
feel.
Yes.
Just spouse and
Absolutely.
everyone's like doctors or anything. So that would help.
Yeah. Um, any word of caution for our female viewers listening to us? Like you want to aware them about something?
So I would really tell that you don't have to shy away from your any sexual desire or sexual problems, anything. You just need a proper guidance. If you are not aware of it, meet your doctor, basically a gynecologist who is friendly. Meet a sexual health expert who is again friendly. You can meet a homeopath also. They deal
Yeah.
with sexually, sexual health issues also. So you can meet them, you can talk with your friends, you have to be open about it. There is nothing wrong in it.
Yeah.
It's not a social taboo at all. It's just a normal thing which we have made it because of our orthodox society. We have made it a taboo thing and all. So just open up and talk. That's it.
Yeah, I agree. So, doctor, let's take up some questions which the viewers are asking. Um, the first question is someone is asking, do we have to take a homeopathic medicine permanently if we have PCOS?
What? Sorry, I didn't hear you.
Do we have to take homeopathic medicine permanently if we have PCOS?
It's from your question is here.
Can you hear me now?
I can hear the question. What we have to do permanently?
Yeah, so I'll read it out slowly. Do we have to
Ah,
take homeopathic medicine permanently if we have PCOS?
yeah, so permanent PCO is, it is little bit tough to, completely cure it, but symptoms can be managed with homeopathic medicines. All the symptoms, most of the symptoms can be managed with
Yeah,
homeopathic medicines. Curing is difficult, but we can with lifestyle. It is a lifestyle. You have to change your lifestyle and everything,
yes,
not just homeopathic medicine. Food, health, you exercise. What you are exercising, that is also important. Just walking is not advisable in PCOS. You have to do weight training. So that is the thing. So that all these thing matters. Yeah.
okay. So, doctor, I think we have only that thing.
I have
Um,
one question. I had one question when I had there
yeah.
were two or three questions.
Okay.
One I had got in my DM, that was that if a female patient if a female patient does not want to do any sort of intercourse or any sex position or something, then she should
Yes.
be forced or not. So that is what it was asked, and I want to say, for nothing a female should be forced. If she is
No.
not interested, if she
Absolutely.
doesn't want to do it,
Yes.
then she should not be forced for it. She should definitely be respected, and that should be the thing.
Yeah, you're totally right. There is like irrespective of gender, we should not force anyone to do any kind of thing. Not even about
Yeah.
getting involved in
Getting
pregnancy. Yeah.
involved. Yeah, exactly.
Yes.
Exactly.
Um, Doctor, would you like to share some more questions like this?
No, I think so. I've said enough.
Yeah, this was
If
a
is
whole
there any
lot of
question, I'll
knowledge
definitely
we
like to
gained.
answer.
Uh, no, I don't see any kind of questions people are asking here. So that
Okay.
was one we answered. And thank you that you also responded to one of your DMs that you used to get. Um, so thank you so much, Doctor, for giving your precious time and answering such like valuable questions. These are so much important nowadays. People don't speak up, and yes, there is a problem in that, and we really are left behind in talking about sex and using these terms, and yeah, improving our vocabulary in that part. Thank you so much,
Exactly.
Doctor. Yeah, it was really lovely. Thank you everyone for watching.
Bye bye.
Bye.